Everyone. I'm Martha Zavala, President of the League of Women Voters, Pasadena area. Welcome to League at Nite, Reinventing Medical Education in Our Community. Tonight we have a wonderful panel who will highlight the new medical school here in Pasadena, the Kaiser Permanente Bernard J. Tyson School of Medicine, Kpsom, to those in the know. This new medical school is unique in a variety of ways, and to describe its uniqueness, we're honored to have with us Doctors Maureen Connolly, Lori Carter-Edwards, and Lindia Willis-Jacobo, plus Hunter Richards, a Kpsom student. Before we bring them on, I'll explain today's program format. I'll start by introducing our program facilitator, who will introduce you to our four panelists. Once our panelists finish presenting, the Q&A period will start. So we ask that you please enter your questions in the Q&A feature at the bottom of your Zoom screen. Enter your questions during the course of their presentations so you don't forget what you wanted to ask them. Be aware that questions may be edited for brevity and to avoid duplicates. We may not have time to ask all the questions, but if we don't get to yours, please send it separately by email to our events committee. That's at events@lwv-pa.org. That hyphen is very important, or you end up in Pennsylvania instead of the Pasadena area. So lwv-pa.org. We will try to send you an answer within the next few days if you need us to. And please do not enter your question or any comments in the chat box. That is used by us and the webinar staff to keep things running smoothly. If you have concerns about sound or anything else and you want to get a hold of us, please enter it into the Q&A and someone will try to help you out. After the Q&A, we will make a couple of announcements and then close the workshop. So we're also pleased today to announce that Pasadena Media is again recording our presentation, and we'll be posting the video on our YouTube channel. For those of you who didn't know, we post our videos. You go to our website, you can access our YouTube channel, and you can view our events there when you don't get a chance to attend in person. And now to the reason while we're all here. Today's presentation is brought to you by our healthcare committee that's co-chaired by Dr. Morgan Zadowitz. And Morgan is a physician with lots of experience in infectious diseases, epidemiology, I can't say that word, and public health, among other things. She will facilitate the program by introducing our speakers and later moderate the Q&A period. So please welcome Dr. Morgan Zadowitz. We're very pleased to have her as a member of our league. Morgan.
Thank you very much, Martha, for that kind introduction. And I would like to welcome everyone to this panel presentation brought to you by the Healthcare Committee of the LWVPA. We first conceived the idea for this presentation back in November of 2020. But the coronavirus and its multiple surges supervened and made it exceptionally hard to pull off. So we are thrilled to finally bring this idea to fruition this evening. We thought it was important to learn more about the Kaiser Permanente Bernard J. Tyson School of Medicine, as it is a new and innovative medical school right in the middle of downtown Pasadena. And we wanted to understand this medical school through the lens of current topics of importance, such as issues with the delivery of healthcare, racial disparities in healthcare, and issues of climate change and healthcare. So we have invited an outstanding panel of Kpsom faculty to introduce this medical school to all of us. And as an aside, I would also like to reiterate that if you have questions, you may type them into the Q&A box at the bottom of your screen. Your questions will be picked up and we will try to answer as many questions as possible towards the end of the program. Please do not enter your questions into the chat box. So, without further ado, I would like to introduce our first panelist. Dr. Maureen Connolly. Dr. Connolly is the Senior Associate Dean for Academic and Community Affairs and Professor of Health Systems Science. She came to Kpsom 3 years ago after 25 years at Harvard School of Medicine, where she was Dean for Faculty Affairs for the last 8 years. She is an internist by training. Dr. Connolly, welcome.
Thank you so much, Dr. Zadowitz. Thank you, Ms. Zavala, Dr. Thad Zadowitz, and the Healthcare Committee for inviting us. On behalf of our Dean, Mark Schuster, and my colleagues who are with us tonight, we're just thrilled to join you and to share a bit about this amazing school that we've all migrated to from different parts of the country. And thank you, Ms. Bell, for advancing my slides so we can go on to the first slide. So I thought I might just give some context for why there's a Kaiser Permanente Bernard J. Tyson School of Medicine. Many of you may be familiar with Kaiser Permanente. Many of you may be members of Kaiser Permanente, and you may or may not know that it was founded in 1945. You see a picture here of Dr. Sidney Garfield with Mr. Kaiser planning to build what came to be really a revolutionary form of healthcare. Next slide. So this Kaiser Permanente is currently the largest not-for-profit integrated health system in the United States, meaning it includes hospitals, a health plan, and clinicians. Next. It is among the highest ranked health plans in the United States for quality of care, and certainly has a very strong presence throughout California. Next. Some of the focus of the organization has been on quality improvement, analyzing data, pursuing evidence-based medicine to provide health to the full population of more than 12 million members, and really focusing on patient-centered care. And one thing that was not well known to me, I certainly knew of Kaiser Permanente and had collaborated with colleagues here, but I didn't appreciate the very strong educational footprint that Kaiser Permanente has had really since the 50s, when the first residents joined Kaiser Permanente. In the Southern California region alone, there are over 1,000 residents and a comparable number of medical students from schools all over Southern California, USC, UCLA, and others who have come to Kaiser Permanente to pursue their training. And I think that that long experience with education and the very distinctive types of care that Kaiser Permanente offers really inspired the organization to think about having its own medical school, and hence here we are today. Next slide, please. The mission of the medical school is to provide a world-class medical education that ignites a passion for learning, a desire to serve, and an unwavering commitment to improve the health and well-being of patients and communities. And I have to say, this mission statement and the vision and values of the school really grabbed me as an extraordinary sort of commitment to priorities that are very important in healthcare. And I think that probably is true for all the panelists you'll hear from tonight. Next slide, thank you. So as you, I assume all know, we are located in Pasadena, California. We're very fortunate to be here and have felt so welcomed in the community. Our clinical settings, as you'll see, are across Southern California, but we also have access to the other regions of Kaiser Permanente, from the Mid-Atlantic to Georgia to Colorado, Hawaii, places where our students can do rotations. We've started on what might be considered the small size for a medical school, with about 48 to 50 students per class. And our students are invited to come here to explore any field. So there has been sort of a burst in new medical schools in the past 10 to 15 years, and many of them are focused on strictly producing additional primary care providers. We're huge fans of primary care. We'll be thrilled if any of our students head in that direction, but we also are encouraging our students to follow their heart and their path. So there's no absolute commitment that they make, for example, to pursue primary care. The other thing I'd mention is that we expect our students not to stay at Kaiser Permanente. They're welcome to. We hope maybe some will want to do their residencies here or be clinicians here, but the school was not developed to produce a workforce for Kaiser Permanente. In fact, I think we will have failed if that is the upshot of our graduates in in entirety or to a large extent, because we're hoping that the lessons learned in this unique health system actually will disseminate across the country through our graduates. So our students are not obligated to stay here. And I'll just tell you that Kaiser Permanente hires in its 12,000 physician workforce about 700 new physicians a year. So this small school could in no way replenish the ranks. So that was definitely not a major focus of the school. Next slide. This is a building hopefully some of you have seen at the corner of South Los Robles and Green Street. It's a brand new building, and I'm afraid it opened its doors during COVID, which is why we're sad not to have been able to invite you tonight or to have had visitors of any great number from the community because of COVID. The next slide will show you that front entryway with our first class. I'm fine to go ahead to that next slide. The very first day our students arrived. And as you can see, we've been able to open during COVID, which we consider a great outcome. It was obviously a strategic decision, a difficult decision in light of the pandemic, but because we're a new building with new HVAC and other resources, we're able to safely teach our students in the school building. And with one class and now our second class here arriving this past summer, we have the room to spread out so people can be 6 feet apart. And we've been very fortunate to have no cases of transmission and to be largely in person for most of both years so far. So we're very fortunate. We can go to the next slide. I just want to say a bit about the leadership, and the next slide will show you images of some of my colleagues you'll hear from tonight. Feel free to advance, Ms. Bell, if you would. And I'll just mention in the bottom row, second from the right, Mark Schuster, who's our dean of the school. And we have attracted leaders from across the country. We have a fabulous faculty from Kaiser Permanente and leaders from Kaiser Permanente, but we've also brought colleagues, I'll just say Dr. Carter Edwards from North Carolina, Dr. Willis Jacobo from San Diego, but literally every corner from Florida, Chicago, Texas, Washington, all over. And I think that integration of individuals from a variety of medical school experiences has really enriched our ability to plan and think sort of out of the box about where we want to go with medical education. So this has been an extraordinary team to be a part of, and really was the vision of our Dean Mark Schuster to bring colleagues from all over the country. Next slide, if you would. So I thought I'd share briefly the educational approach we're taking. The next slide will show you sort of the traditional model that I was trained in many years ago, was that the first 2 years were focused on biomedical science, sitting in the classroom, learning the basics of everything from biochemistry to pharmacology. And the second 2 years were focused on clinical medicine. And that was the norm for many, many years, really since the turn of the last century, practically. One thing that we're doing that's quite different at our school, the next slide will show, is that we've added a third pillar, and that is health system science. This is something that Kaiser Permanente is particularly strong in thinking about systems of care that benefit populations, using evidence to inform those systems. And so we actually have made a fundamental element of the training to teach students about the systems of care, whether it's how to do quality improvement or how to understand the US healthcare system or international healthcare systems. That's the department I'm based in, and I think it is actually the first department of health system science of its kind in the country. And I think that this gives our students a well-rounded exposure to medicine because it is the science and it is the care. But if we don't understand the systems in which we work, we probably can't affect the changes that we want to see in healthcare and medicine. So thrilled about that. And I'll go into a little more detail about some of the aspects of the curriculum on our next slide, starting with the fact that we have, with a small class, the opportunity to do small group, case-based team learning. And by that, I mean that we, for our fundamental integrated science courses, we have groups of 8 students and 2 faculty working together through a problem-based learning approach. And we call this almost a spiral curriculum, that problems that are addressed in the first year may come up again in the second year when the students have additional exposure and sophistication. And this kind of active approach to learning has been shown to be more effective than the types of lectures I sat in the back of the hall for. And it really engages, I think, our students with they need to come prepared to have done a lot of preparatory material and to engage with each other, really experience that team approach to healthcare. Next, if you would. So we're taking what is not absolutely unique, but pretty unusual approach of doing anatomy without cadavers. And we're using simulation and other approaches to try to approximate certain experiences. And I'm so lucky that we all are that one of our first year students, Hunter Richards, is with us. And I hope he'll touch on this a little bit. The next slide will just give you an example of one small element of our anatomy course. So we're able to use a tool called Hololens that allows our students to see 3D images of the heart, for example, and compare it to what you're seeing there, which is a CAT scan, and really understand sort of all facets of the heart without actually dissecting a cadaver. These are not the only tools we have in our anatomy lab. We actually have plastinated cadavers that have already been dissected, prosected, it would say, so that students can see all sort of levels of nerves, veins, arteries, muscle. It's really an extraordinary set of tools that we provide to the students, and it's a different approach. So as one of our department chairs often says, learning how to dissect a cadaver in med school, which is often considered a rite of passage, doesn't make you a better surgeon or a better doctor. It makes you a better person who knows how to dissect cadavers. That's not a skill set that is essential for practicing medicine, but understanding the human body from a 3D perspective with multiple modalities, we think does actually enrich our students' understanding of human anatomy. Next slide, if you would. I'm sorry, yes, longitudinal integrated clerkships. One of the things that we've been able to do with the benefit of being embedded in this integrated health system is expose our students to clinical experiences very early in their career, really in the first several weeks. And the next slide will show you the sites where our students are based in Downey and at the LA Medical Center, Panorama City, Fontana or San Bernardino, South Bay, and West Los Angeles. So in the first year, our students spend a half day a week in doing either family or internal medicine. Each student has a one-on-one preceptor they will work with in those primary care disciplines for 2 years, getting to know that physician's patient panel and the entire healthcare team they work with. In year 2, they're then exposed to other disciplines, OBGYN, pediatrics, psychiatry, surgery, and they also do emergency medicine shifts. And the next slide will show you that this one-on-one approach really, we think, builds relationships for students, role modeling, and also opportunities to really have a deeper understanding of our practice. We are deeply committed to encouraging curiosity, grappling with uncertainty, which is at the heart of how we've been managing the pandemic, as you know, and to be committed to lifelong learning. Next slide. Another strong emphasis of the school is on well-being. This is the Thrive motto of Kaiser Permanente, and we actually built into our curriculum opportunities 4 weeks a year in the first year for students to step back from the clinical science, the health system science and basic science, and focus on working with a coach, a physician trained coach who helps with academic support and with really allowing students to work on their identity formation as physicians. Next slide. I'll just mention that we have a very robust service learning program that Dr. Carter Edwards will be telling you about right after me. Next slide, if you would. We have multiple degree programs. We have fabulous partners with Caltech. We have an MD PhD, a Master of Public Health joint degree with UCLA, and a Master of Health Administration with the University of Southern California. Next slide. And you may have heard, and it's one of the hallmarks of the school, that we are privileged to be able to offer full tuition and insurance coverage for every member of the class, the first 5 classes through their entire 4 years. This was a strategic decision of our board of directors and our dean and of Kaiser Permanente to make sure that no one would be denied the opportunity to study medicine because of financial limitations. We think it opens the doors to meet many of our goals around diversity and in the broadest sense of the word. Next slide. We also provide grants and aid to offset living expenses. It's a little expensive to live in Southern California, so we've been able to help our students who need that support. Next slide. And with that, those early slides I showed you had a link to a 14-minute virtual tour of the building. It's here at the end of this slide, and I hope you'll take advantage. And with that, thank you again, Dr. Zadowitz. A pleasure to be here.
Well, thank you very much, Dr. Connolly. Having gone to medical school in the Pleistocene era, I can tell that medical school has changed a great deal and has become significantly kinder and gentler. Our second panelist is Dr. Lori Carter-Edwards. Dr. Carter-Edwards joined the school just this summer as the Assistant Dean for Community Engagement. She previously served as Associate Professor in the Public Health Leadership Program and the University of North Carolina, Chapel Hill Gillings School of Global Public Health, and is a national leader in community-partnered participatory research and clinical and translational science. Dr. Carter-Edwards, welcome.
Thank you so much, Dr. Zadowitz. Appreciate this and appreciate the opportunity to speak with all of you. And had a chance to hear from Dr. Connolly, and I'll just follow up after her. It's been a wonderful opportunity to be here just for the 6 months that I've been here. So once we have our first slide up, I'll tell you a little bit about our Office of Community Engagement. And while we're waiting for the slides to come up, I will say this, that there are few offices of community engagement in medical schools across the country. We combined with what you've heard about in terms of our health system sciences makes us extremely unique. And so this is a great opportunity for our students to actually even understand how to work in the communities. So next slide, please. So our office is designed to support the school by bringing the opportunity for resource building and partnerships, sharing information, conducting trainings, and promoting opportunities for authentic engagement activities by practice and service and research. We support not only Pasadena, but the greater Los Angeles area and beyond. We have established relationships with our partners at the other KP regions as well. Our goal is to integrate the school into the community and the community into the school through these bi-directional partnerships, not just what we're interested in, but what is the community interested in, and how can we bring those interests together to help our students even advance their medical training. And we do these partnerships with educational institutions, our community health centers, which I'll tell you more about, and nonprofit organizations who work with us, and I'll talk to you about that with our stakeholder committee. We serve also as a connector to and with KP and the community and Kpsom. So we serve in trying to bridge the relationships between these three entities. Next slide, please. Dr. Connolly mentioned service learning, which is an opportunity for our students to actually not only work, as you heard about in the longitudinal clerkships, but this is an opportunity for them to work with our federally qualified health centers. This is a 2-year experience, and it provides, through this accountability lens, activities that are aimed at addressing social and structural factors to reduce health inequities and to affirm physician accountability to the communities and the populations that we're serving. It's also an opportunity for them to do capacity building with and for community partners to address these inequities in health through evidence-based and community-level interventions. And service learning also provides an opportunity as a valuable venue for the self-reflection that you heard Dr. Connolly mention in their professional development as systems thinkers and designers to advocate for health equity. And what's unique here is they're now thinking at systems levels and working very closely, just like you heard about the longitudinal clerkships. They have the opportunity to connect early on and understand what are the social determinants of health, as you often hear about. How does this mean when we're working with our qualified health centers and with different populations based on color, economic status, and the like? Next slide, please. So you've already heard about the 3 pillars from Dr. Connolly. And what's so unique about this opportunity is this is where the physicians have an opportunity, or our students have an opportunity to be physicians who are social change agents. And they're informed, as I mentioned, about social determinants of health. and systemic oppressions that impact the community's health and health equity. And physicians who incorporate that understanding and work within the community can bring about the systemic and structural changes that improve health and health equity. And this is what helps make our medical school different and unique and necessary as we move forward. Next slide, please. So our service learning curriculum is multidisciplinary in nature. We work with our community clinic preceptors at our federally qualified healthcare centers. We have our service learning leads that are part of Kpsom. We as the community engagement team work closely with the team to provide services as well. Our administrative team within the school and our Office of Medical Education, because this is a mandatory component of the medical training. Next slide, please. Next slide, please. So, thank you. So we have a map here of our service learning clinic sites, which align closely with our sites for our LICs, or our learning integrated curriculum, learning integrated clinics. And so here we have 6 sites that we primarily work with our FQHCs, and they're in these same service planning areas: Pasadena, Downey, Panorama City, Los Angeles, and West Los Angeles, the San Bernardino County area of Fontana, and South Bay. Next slide, please. And just wanted to show you in this slide how the federally qualified health centers align with the clinic sites that we've already heard about from Dr. Connolly. And this is all deliberate. So while they're doing the clinic work through the longitudinal clerkship, they're also getting an opportunity to be closer to the community and have the opportunity to work with our FQHCs, work with that patient population, and understand how the system either works or doesn't work, the challenges that happen within our FQHCs, and learn what does it take to actually do this work and provide clinical care in these particular settings. Next slide, please. At each one of the federally qualified health care centers, we have our service learning leads from Kpsom, as well as a community clinic preceptor from the FQHC. And this partnership is critical to the educational process for our medical students. This is an opportunity for us to connect and understand both the training that occurs from our service learning lead in conjunction with our community clinic preceptor. And here we have the ones from Downey, where we have Jeff Bretler, who represents us, and Nicole Cervantes, Reza Carvano, Diana Concanon, Isabel Chen, and Eig Gallegos, and Johanna Barnes-Rogers, all from Yuma Clinic and South Bay. You have Dr. Connolly and Ngozi Chukwu from the San Bernardino area with Park Tree, Alma Lopez and Dr. Roger Peaks at the Valley site in Panorama City, and John Sue and Paul Gregerson at the downtown LA site. And they coordinate, we meet weekly to talk about the training, the components, which I'll show you shortly, an example of some of the material in the curriculum. But we talk about what works. We talk about the components of what it means to actually work within the federally qualified health centers. We also talk about what we hear from the students as they're learning. We're learning this as we go along. So they provide very good input, and they're not afraid. We have, and you'll get a chance to hear from Hunter as well. Their input matters, and we actually try to incorporate that while we're doing the training with them and for them. Next slide, please. Our service learning team that is part of the curriculum development, and as I mentioned, some of the resources that we help provide in terms of community engagement, and with our team here that's primarily within our health system sciences department, are Dr. Chen, Dr. Kim, Cynthia Santana, Dr. Chung, Dr. Connolly, and Rose Rodriguez, who played a critical role in creating these opportunities for our agreements with the federally qualified health centers. And so again, we help support the service learning lead team. Next slide, please. This is an example of the curriculum that the students will get in the phase 1 or the year 1 training. And you'll see the series of topics here that they have, that they go through. And some of it is basically taught through materials that they receive through the service learning lead training, along with support from our community clinic preceptors. And there's a lot of training that's around experiential growth. So there's much discussion about these particular topics. And as you can see here, we have topics such as just the general role of health in the community and how the FQHC plays a critical role there, exploration of the FQHC services and financing. How do they actually operate fiscally? Civic engagement, health and transitions, the role of quality improvement and commitment to health equity, which is the core of Kpsom, exploring intersections between art, healing, and community liberation. So we partner with organizations to bring art to the training, and also how art can be healing for our medical students as well as the community. We talk about immigration and health, compassion, empathy, and trauma-informed community engagement, communities experiencing homelessness and housing justice, and substance use in communities. And this is just the first year, this is the first phase, and there's another phase as well, but this just gives you an example of the rich curriculum that they get exposed to as part of this additional component within our health system sciences department. Next slide, please. In the Office of Community Engagement, we are charged with bringing the community into Kpsom and Kpsom into the community. And one of the things we have done is we've created a community engagement stakeholder committee. And this committee is 13 peers within the Pasadena and Greater Los Angeles area, representing the different regions where our FQHCs and our clinic sites are, from CEOs of organizations to a regional patient advisory committee member, to other members within the community who are experts in their area. And they've come together with us, and we convened our first meeting in December 2nd to give us advice on and guidance on what matters in the community, but how we can partner together in the medical education with our students. And the two areas that rose to the top as priorities that were mentioned by the committee are access to care and equity. And we're hoping that we're going to have our next meeting in March, and we've just begun this process, and we're hoping that they will help us design goals and strategies together with us for this next year to address the areas that they felt were most important. Next slide, please. And finally, this is my last slide, and we are an emerging office. We are doing new work. I've been on part of Kpsom since August 30th of 2021, and we're now in the process of developing a roadmap to help us identify strategies and tactics for supporting the school, Kpsom, and our community in the area of community engagement. And so what we've done is we've co-designed this approach with partners in the community, within Kpsom, and within Kaiser Permanente to try to address these areas that you see here in this figure. We have footprints as community engagement in the area of medical education, which is basically training medical students on the fundamentals of engagement and leadership and community organizational capacity. Practice and service, where we're trying to advance clinical practice through a co-designed lens, that we're doing this together. Engage research, which we're really getting ready to launch, is how do we actually do research in this space, but engaging with our partners in communities and patients. Healthcare and community systems. We have a healthcare system, but communities operate as systems as well. What does that look like? And how do we work collectively with networks within communities? And then finally, community relations, where we engage in outreach through appropriate resources and opportunities for building trust partnerships, and bidirectional learning. And so what we're hoping is, as we continue to meet with our facilitators, after we've had meetings with these different stakeholders, what will be our strategies moving forward for the next 1 to 3 years in this office. So we're still emerging, and we're looking forward to partnering with our communities. That's all I have here, and I want to thank you so much, and look forward to listening to all the questions. Thank you so much.
Thank you very much, Dr. Carter Edwards, for that illuminating presentation. And I'd like to introduce our third panelist, who is Dr. Willis Jacobo. Dr. Willis Jacobo is the Senior Associate Dean for Admissions and Equity, Inclusion, and Diversity, and is Professor of Clinical Science at Kpsom. She previously served as Professor of Pediatrics and Assistant Dean of Diversity and Community Partnerships at the University of California, San Diego. She joined Kpsom in 2018. Dr. Willis Jacobo, the floor is yours.
Thank you so much, Dr. Zadowitz, and it's an absolute privilege to be in this space with you. Many thanks for the kind invitation to provide a brief overview of equity, inclusion, and diversity at our school. And while the slides are being brought up, I should point out that we talk about equity, inclusion, and diversity. We use a very short acronym, EID. So next slide, please. So I always like to start my presentations by talking a little bit about the mission and vision of our school. And I think the main reason for that is it really does serve as our North Star. It guides all of the work we do here at the school. And I will say, and Dr. Connolly alluded to this, as did Dr. Carter Edwards, I think many of us came to the school precisely because of its mission, vision, and core values. Next slide. Equity, inclusion, and diversity are really foundational to the school. Our school was built on these foundational principles, and it really traverses every single office, every department, and it's really deeply embedded in the fabric of the school. Next slide. Now, this is our Office of Equity, Inclusion, and Diversity team. We are small, but it's a really mighty team. And I would say that every single person on this slide is deeply committed to the work, and they each bring a unique perspective and lived experience. Next slide. Just a little bit about our strategic framework. It really informs our strategic priorities at the school. And, you know, throughout the school, we do try to ensure that EID principles are embedded in our student recruitment and admissions, as well as in our faculty and staff hiring. We also ensure that we're providing the appropriate resources to support our students, staff, and faculty once they do get to the school. And that is part of our retention strategy. We try to make certain that we're providing, that we're engaging with our community partners in the development of our pathway programs. And I'll talk a little bit more about our inclusive curriculum, but that is actually a lot of the work that we're doing to ensure that our students are appropriately trained in this area as well. And then, you know, we know that culture and climate are extraordinarily important in any setting that one is in. And so a lot of our work is actually focused on culture and climate. We can have the very best strategy in place, but if we don't have a healthy culture and climate, then the likelihood of success is pretty low. So we are really deeply committed and are working quite hard at continuing to build out and develop an inclusive culture. Next slide. I also wanted to highlight that we ensure that all of our systems, our processes, our policies, and our practices have EID rooted in them. There's accountability and metrics that are built out throughout the school. We have an anti-racism action plan. And then we also make certain that our EID work is innovative, that there's scholarship that we are able to produce as a result of it, and that it's always evidence-based or evidence informed. Next slide. So in terms of our student recruitment and admissions, we try to ensure that we're utilizing a holistic model, a holistic approach. I think when you look for the last couple decades, one of the ways students are primarily selected for medical school is through their metrics. How high is their GPA? How high is their MCAT score? And while we do know that metrics can, to some degree, predict student success, we know that there are many, many other pieces to every student's story. So a holistic model or approach really allows us to view every student who applies to our school through a unique lens. So we are really interested in knowing who that whole person is. And it allows us to recruit students who are fully aligned with our mission. So at every step of the way, we are looking critically at the lived experiences of our students, and we're looking at the many attributes, right, that the students bring to the table. And then we're putting all of that together alongside academic metrics in order to get a really good sense of who that student is and the likelihood then of that student succeeding at our school and in our curriculum and beyond. We're not just looking for good students, we're trying to ensure that our students are in fact going to be exceptional doctors, leaders, and advocates. Next slide. And with our recruitment strategy, I think we have been quite successful. This is the student profile for the 100 students who are enrolled at our school. The mean age of our students is about 24 years old. A little under half of our students are from out of state, a little over a half are women. And then we have a very high number of underrepresented and under-included students at about 38%. A little over a third are from socioeconomically disadvantaged backgrounds, and about 20% of our students are first generation, which means that they are the first members of their family to attend college. Next slide. Wanted to just say a few words about our pathway programs. We have a few partners, but I wanted to highlight two main ones. One is the STEM Academy of Hollywood, and this is a neighborhood high school which serves primarily Latino students. And this is a school whose mission is very well aligned with ours. We have a number of programs with them, but one of the main ones we've been focusing pretty heavily on are the peer mentorship pods. And what this means is that we are identifying medical students at our school from our first year and our second year class, and we're really pairing them alongside high school students, but also having Kaiser Permanente resident physicians as part of that mentorship pod. We know that mentorship has a significant role in terms of one's career trajectory. And we also know that mentorship, the earlier one begins with mentorship, the more successful the mentee's trajectory will be. And so we've been engaged with this group since about 2019 or so. And then the other program I wanted to highlight is the Mi Mentor Medical Student Ready program. And Mi Mentor is a national mentoring organization focused on mentorship of students from traditionally underrepresented and underincluded backgrounds who are interested in medicine. So these are not high school students, these are college students who are then mentored by way of monthly workshops, which will help them through their meeting their goal of becoming physicians. Next slide. I mentioned curriculum as one of our strategic priorities, and we really focus our efforts on curricular equity. We know that EID content material in the curriculum is very important, but what we've learned is that we do need to go a little bit beyond just content. So we're looking at integration in a lot of our required courses that focuses on social justice, on equity, on diversity. And we also know that helping our faculty with accessing inclusive design materials are also important to putting forth an inclusive curriculum. And then lastly, a really important aspect of an inclusive curriculum is process and training, ensuring that our faculty members not only have access to the appropriate resources, but that they have the appropriate training in doing so. Next slide. And just a little bit about the process and training, because this tends to be the most resource intensive aspect of the work. And so as it pertains to process, I'll show you the patient tracker, but our faculty have the opportunity to get the patient cases from a patient tracker. We have an EID guidebook that was developed by our faculty director of inclusive curriculum. We provide our faculty members with writing checklists, and then we do go through a multi-stakeholder EID review process to make certain that the materials that will be delivered to the students are ready to go. And then as it pertains to training, handling difficult conversations, we don't have large lectures. Our learning and teaching happens in very small groups. And we know that a lot of these topics can get pretty heated. So we try to ensure that our faculty are trained up as well in inclusive facilitation. And then we always have a just-in-time training just preceding the sessions themselves. Next slide. This is no need to try to read the very small boxes, but this is what the case profile patient tracker looks like. And this is a tool that was built by our school. It allows us to ensure that our case profiles, the cases the students are utilizing for learning, reflect the local health center demographics. Dr. Conley showed you the 6 medical centers our students go out to. And so we are really trying to simulate that exact profile in their didactic classroom setting. Next slide. And then we also are very, very fortunate to have a graphic designer. This is an inclusive visual library that's being developed by the school. When I went to medical school in 1988, we didn't have a lot of inclusive images, right? And so we're trying to ensure, again, through visuals that our students are seeing, a reflection, representation from folks from all walks of life. So this has been one of the more exciting aspects of building out our inclusive curriculum. Next slide. And then this is our EID guidebook. It is an online guidebook, so faculty members can engage with this guidebook from their laptops, from their computers, and it really provides terminology guidelines for ethnicity, gender, sexuality, etc. And so I think it has been a helpful tool in terms of guiding our faculty in developing their teaching materials. Next slide. And this is just to demonstrate to you kind of our process for review. There's a lot of planning that goes into putting the teaching sessions together. There's drafting. We have curriculum designers who are part of the crafting of the curriculum. And then we have a whole bunch of edits that we try to get through. And then we have a full sweep of the entire slide decks about a month before the material is taught. And all of that is done in order for us to catch things that may come up. And I should point out, this is not a perfect system. We have students who actually catch things while this is being taught in the classroom. And so we can continuously iterate on this process. Next slide. And then I mentioned earlier that once we get our students in the building, we want to be able to support them. And so one way we support our students is by way of a whole host of student affinity groups. We have a Latino Medical Student Association, a Student National Medical Association, an Asian Pacific Islander Medical Student Association, as well as a Med Pride group and a Women in Medicine group. And there are many others. I've just highlighted a few for you. Next slide. And this is my final slide. This is yet another way by which we support our students. It's another layer of support. And we have a number of mentorship programs whereby our students are matched with faculty mentors based primarily on preferences such as identity, religion, specialty, etc. So we try to ensure that we have robust support in place for our students. And in closing, I would just like to say that all of the work we do in our Office of Equity, Inclusion, and Diversity is in partnership with other offices and departments at the school. There is no way we could do this work alone, nor should or would we want to. So again, immense gratitude for the opportunity to speak a little bit about equity, inclusion, and diversity at our school. Thank you so much.
Thank you, Dr. Willis Jacobo, for covering that very important subject so extremely well. And last, but definitely not least, is our fourth panelist, Hunter Richards. Hunter Richards is a first-year student at Kpsom. Prior to enrolling, he earned a degree in physics at the University of California, Berkeley. He taught high school math for 3 years and was a policy consultant for the Organization for Economic Cooperation and Development. With his wife and young daughter, he moved to Pasadena last summer from the Bay Area to begin his medical school journey at Kpsom. So Hunter, we would really appreciate it if you could tell us why you chose this medical school and maybe give us an idea of what it's like during the week to be a first-year medical student at Kpsom. You're on, Hunter.
Thank you. And just to echo what everyone has already said, thank you so much for having me tonight and having the school. And I'm really excited to share the experience of a student at the school. The question of why Kpsom, I could talk for my entire 15 minutes about that. We've heard 3 great presentations, and those presentations encompass so much of why I've chosen to come to this school. I am really passionate about the work of EID. I'm passionate about education in general, coming from a high school teaching background. And a lot of schools in this country are trying to work in the fields of EID and changing medical education and working with the community. The thing that really drew me to Kpsom is that this school isn't just trying to change within an existing system, they are building this from the ground up. So there are opportunities and they are trying to find new ways to do things rather than just trying to fit it into pre-existing systems. I also am really drawn to the school because it's a small school. I come from Berkeley, 10,000 students. And my professors, they knew me-ish, maybe in a lecture hall of 300 people. But I have the opportunity here to know every single one of my faculty, as well as all the deans. It's an amazing experience to walk down. I never thought this would happen, but walk down the hall of the medical school and have the dean of the medical school ask me how my daughter's doing and remember my daughter's name and have a conversation about my daughter. And it may be a little unfair. He's a pediatrician, so he loves kids. And so, he likes to have conversations about what children are up to and how they're doing. But it is really a familial feel in the school. And when I was trying to choose a medical school, I wanted somewhere that I could feel that I was really at home with everyone and that I could be myself and that I could ask questions and I could go to my faculty and they would know who I am and be able to talk about things on a personal level and have that experience. And so KP is really trying to build that with their classes to enable us to push the boundaries in health systems and push the boundaries in medical education, push the boundaries in medicine in general, and push us to try to change this field. And without that personalized aspect of it, if we were just another student in the class, it's hard to push students to change anything if you don't know those students. And so, well, we've talked a lot tonight about the relationship with community and the work the school is doing. The fundamental aspect for myself is that we have that personal connection and that they can work with us on an individual level to find the things we are passionate about changing and give us the resources to pursue changing those aspects of medicine. Finally, I come from a background of teaching, as I mentioned, and policy. I really like the health system sciences. I like being able to understand policy and equity and science and service and population health and healthcare quality improvement and how all these things come together to create the system of healthcare we have in this country, so that I can then find where there are places to improve it. And as many of us know, there are lots of places to improve it, and finding those key kind of linchpins that really help us push the system forward. And so having this as part of our curriculum was another just huge draw for me. And finally, well, it was mentioned, I have a daughter, I have a wife, and medical school is a large burden on individuals, financially, mainly. And for myself, it was a huge thing that I could come to medical school being a little bit older than most of my classmates, having a family, and be able to know that when I am done with medical school, I can choose any specialty I want without the fear of student loans. And that if I wanted to go into primary care medicine and serve underserved populations, that I wouldn't have to be thinking about my bottom line. I could think about my patients. And so it really enabled me to pursue the type of medicine I want and be the kind of doctor I want to be. So as I said, I could continue talking all night about why Kpsom. I could go into much granular detail now that I'm here and all the things I love. But what I would like to do is just walk through a week and how we go through the week as first-year medical students. If you talk to a second-year medical student, their lives are a lot more busy with a lot more clinical work, which is an amazing opportunity that I'm looking forward to in 6 months. But right now, one of the key aspects of the approach to medical education at Kpsom is what is kind of called a flipped classroom, where a lot of our learning and a lot of our reading and kind of investigation is done outside of the classroom. It's done at home. We read our textbooks, and there's an expectation that we come to class prepared to discuss cases, to be challenged, to kind of use that knowledge to actually apply it to things. And that's a very unique approach because so many schools still do the lecture hall. You sit in there, or now that a lot of lectures are recorded, you don't go to lecture and you watch them later. And there is no real accountability for you to act like a professional and show up to class. So on Mondays, we have something called a scientific basis of health. That's our fundamentals kind of health class, science class, where we really dive into diseases and how diseases work and how pharmacology works. And we use the anatomy lab. And often on Mondays, we spend most of our 4 hours in the anatomy lab. We get to use the mannequins that have ultrasounds, that we get to try to find different things in the body with the ultrasound on these digital mannequins. We have virtual dissection tables where we can go back and forth on these tables and kind of zoom in or zoom out and remove this layer of muscle or that layer of muscle. And then we also have the plastinates. And as a whole, this is a very different approach to anatomy. And I actually wouldn't do it any different. I know some individuals who've gone through the traditional route, and I think Dr. Connolly said it, it just makes you good at dissecting a cadaver. Often medical students don't know what they're looking for, and they'll cut through this nerve or that nerve. And it doesn't really often assist when you're in your learning, when you don't know what you're looking for, or you've never done this. And so we have the opportunity to, on the digital dissection tables, to do the same dissection 20 times and look at every little thing in detail and not worry about some of the more difficult parts of anatomy lab, which are that you are working with real human beings. And so you have a limited time you can actually work with them, and you can't go back, and you have to keep moving forward, even if you didn't find something. And so it really aids in our learning that I can go any day of the week and look at the same dissection. And if I have a question, I can go back and go to that same cadaver and the same plastinate and look at every little detail. And so on Mondays, we spend a lot of time in the anatomy lab working on those things. On Tuesdays, we have a class called doctoring. Doctoring is almost like what it sounds. It's all the didactic skills. It's everything we need to know how to do to be a doctor. So from delivering a baby through, well, maybe that's kind of the more extreme end, listening to a heart, doing the basic physical exam to delivering babies, or doing procedures or suturing. We learn those skills in this class called doctoring, and we also learn how to interact with patients, how to take notes, and handle maybe more difficult conversations we might have in clinics. And one amazing aspect of that is that we have this place called the Simulation Center, and the school brings in what are called standardized patients. They are people who are actors. They're specially trained to act out medical cases. They usually work at most of the medical schools in the area, so UCLA, USC, UC Irvine, and they know how to act out a particular case or a particular illness or situation. So, having a discussion about depression with someone, and they really they bring a lot of emotion to the room. And so it is really like dealing with a true patient. And then we also have individuals called physical exam teaching assistants. They focus on walking us through how to actually do physical exam maneuvers and different maneuvers, so that we are working with actual humans, so that before we go and work with a patient, we know how to do everything. We know how to listen for this or palpate for that. And then finally, they have, I call them creepy. They're mannequins. They blink, they talk, their hearts beat. They're fully alive. And I was once stuck in a dark room with one, and it was a little scary. But they are amazing because they replicate so many things that they can change the heart rhythm and heart rate on them. And we can have a code situation with them, and we can try to do different things on these mannequins. And all they have to do is change it on the computer, and the heart rate changes for us. And so it really allows us to practice in settings where we can work as teams and figure out what's going on, and really kind of get a lot of those skills that are best practiced on mannequins. Wednesdays, again, we have the scientific basis of health class. So we again doing a lot more of the science. I'm involved in a lot of extracurricular things. I'm on our class board, which is our kind of traditional student government. I'm working on research. I'm working on different organizations throughout the school. So right now I'm trying to found a healthcare and environment organization. It's an area I'm really passionate about. And so I have some free time on Wednesdays afternoons, and I use that to study for our weekly quiz. I use that to meet with organizations and kind of work on research. And then Thursday is probably the highlight of the week for me. It's the day I get to go be in the clinic. I actually get to work with patients. I get to take everything I learned during the week and use it to work with real individuals. And I'll just quickly share an experience I had today. It wasn't about working with a particular patient, but I was sitting at a desk and across from me was a medical student from, I won't name it, another medical school. And they were like, "Oh, what year are you?" And I'm like, "Oh, I'm a first year." And they're like, "Oh, so you're just shadowing, right? Like you're not doing anything. You just kind of, you're following around. Like, what are you doing in clinic?" And I'm like, no, I'm working with patients. I take histories, I do physicals. I'm working to kind of figure out diagnosis and work with my preceptor to figure out what a plan would be and how to assess it and what next steps are and write that all up in a note. And the medical students like, "Oh, wait, really? Like I didn't get to do that till like halfway through my third year. The first 2 years was just spent in a lecture hall." I'm like, yeah, it's one of the cool things about KP. We really are pushing ourselves to be involved in patient care because that's why we're going to medical school. We're here to be a doctor. And so we get the opportunity to work with patients, and it's been incredible. I've been able to see the same patient twice already in clinic, coming back for routine care and diabetes care and things that so much of our population deals with. And so I get to see the challenges and I get to know these patients and the things they're facing. So rather than what a lot of medical schools do is you spend 3-4 weeks in a clinic and you follow whatever doctor's on call and you move on. You don't get any continuity. I'm really getting that continuity, and it's allowing me to not only experience being a doctor, but actually working with patients and trying to help them improve or find ways to manage different diseases they may have or illnesses. And so it's just an incredible opportunity. And I usually like can't wait till Thursday rolls around, and we get to often see things that we just worked on in the science class and in doctoring. Once a month-ish, I don't go to LIC on Thursday. I go to our service learning site. And my service learning site is the Wesley Clinic in downtown LA. If you're not familiar with it, the Wesley Clinic in downtown LA is actually situated on Skid Row. The majority of their population is individuals on Skid Row. And it is an absolutely incredible experience to speak with the community down there, to speak with the doctors that work at this clinic. And I'm really excited to be in this setting where I'm trying to help improve the care for these patients, improve something in that community, but not do it because I need to be dropped in and because I have to get this done for service learning or anything like that. We're all, my classmates and myself, are motivated to truly change something. And we have a practicum that we need to complete, but we really enjoy talking with this population and finding out what they need, not what we think they need. And so something that I'm working on there is how to make better continuity of mental health for these patients. We see that they come in from care, they get referred to mental health, and there's something that happens in between. And so two of my classmates and myself, we're thinking about investigating that, really trying to dive into where that gap is and why that gap exists. And so that these patients can get the care that they need and want. And then on Friday, again, we have another day of science class, what we call SBH, Scientific Basis of Health. And we usually have a quiz at the end of that day, or get to take it on Fridays. That's kind of a week of what the school structures for us. Outside of that, I spend usually 6-ish hours going through work and studying, and then everything else. I try to leave some time to play with my daughter and run around and spend time with my wife making dinner and doing all the fun stuff of life. So I want to thank you for having me and giving me the opportunity to really walk through what it's like and what the school has provided us and the opportunities they've provided us.
Thank you very much, Hunter, for that very rich presentation of what life is like as a first-year medical student at Kpsom. I think that was extremely helpful. We now have the opportunity to address a number of questions, and we have gotten a whole bunch of them, which span a wide spectrum. And so I think what I'm going to do is combine the questions that came from the healthcare committee with the questions from the audience so that we can cover as many good questions as possible. And I think that I will address the first question to Dr. Connolly because she and I have had some conversations about what we've called myth busting. And myth busting is about myths that may have arisen about the Kaiser Permanente Bernard J. Tyson School of Medicine. And she made the point to me that she wanted to dispel some of those myths. So my question to Dr. Connolly is, are there any myths that are out there that we haven't dispelled yet?
Thank you, Dr. Zadowitz. I mean, there's one that I'll mention that I don't think it's necessarily obvious, though, of course, we are affiliated with Kaiser Permanente and we're embedded in the health system. The med school is a separate 501c3. So we have some autonomy from the health plan. We work in great collaboration. They are our staunchest supporters. Our faculty come from the Permanente Medical Group. But just to say that we do have an independent organization. And I think that's been a great opportunity because an academic institution is very different from a health plan, from a hospital. And so we need different policies and procedures. So that's one thing. And I did mention the desired for our students to go out, like Hunter was describing, to really have an impact and change health systems across the country. So for those, I think the impression has been that the school might be producing physicians for KP, and I'm sure I continued to train at the institution I went to medical school at for a few years. So I'm sure many of our students will perhaps stay for some period of time, but we hope not indefinitely, and for most of them at least.
Okay, thank you very much. Along those lines, we also have some questions that, again, I think I will address to Dr. Connolly, and those are questions about Bernard J. Tyson's vision for the school. And certainly, if the other panelists would like to chime in over that, please feel free. But the question really was about his vision for this medical school.
Thank you so much for asking about Mr. Tyson. I feel so privileged to have met him because he would show up at the school. This was his brainchild with other wonderful physician colleagues who really for a decade or more were planning this school. And I think that he always championed the themes of equity, inclusion, and diversity that Dr. Willie Jacobo talked about, community engagement that Dr. Carter Edwards talked about, and made sure that Kaiser Permanente was a learning health system. So he really established the foundation. I mean, a tremendous loss to all of us in medicine and healthcare in the community. But it was a thrill to be able to name the school in his honor. And I think we want to carry that mission forward, and welcome my colleagues if you want to say anything else. But I just think that he set the tone, and we're very lucky to bear his name, and we have a lot to live up to because of who he was.
Thank you.
I'm sorry. I think that to add to this, some of the things we're doing, particularly when we think about him in Black History Month, what was amazing, I didn't get a chance to meet him, but just to listen to his story, how he started as an intern and became the president and CEO of this amazing organization, is a testament as a Black male to be able to do this work in this particular environment. And while we're celebrating Black History Month, one of the things I do want to mention that Dr. Connolly leads the effort for is that we have a speakers series. And in that speaker series, we're bringing a speaker for Black History Month, but we also consider these kinds of speakers that would not just come for Black History Month. These speakers will be part of our roster as we move forward to address equity issues, racism, social upheavals, how we're going to deal with social justice. And these are all parts of what we think represent the essence of him. I don't know if you want to chime back in with that, Dr. Connolly.
Agreed. Thank you.
Okay, thank you very much. I think the next question probably is most appropriate for Dr. Willie Jacobo, and it addresses the issue of how do the admissions requirements compare to other U.S. medical schools?
Yeah, no, thanks for that question. And I think that if you sort of look at, we kind of divide up requirements as prerequisites and recommended courses. So there are those that are required in the undergraduate studies and those that are recommended. And I think if you look at them side by side, they're quite similar to other medical schools. But thinking about some of the more distinct components of our curriculum, we have added the humanities, for example, as one of our requirements. And one of the main reasons for that is we do have a narrative medicine aspect to the curriculum. And so we really want our students first in, they can kind of complete that requirement by taking English courses, literature, history, philosophy, etc. And then the other piece I wanted to highlight is, and I think both doctors Carter Edwards and Dr. Connolly alluded to our health system science department. So we want our students to have some understanding of population health, of statistics. And so that is one of the recommended courses. But if you look again side by side, it's quite similar: organic chemistry, biochemistry, etc. So great, thank you.
Thank you. Our next question is, I guess, a question that I think probably we all have, and any one of you can answer it. And that is that Hunter alluded to the fact that it was very helpful from his point of view to be able to go to a medical school where when he was finished, he wasn't going to incur an enormous medical debt. And that obviously frees him to make potentially broader choices in terms of his medical specialty as he goes forward. And so the question is, what happens when the 5 years are up?
I'll start. We are very committed to trying to find ways to continue the tuition support at the school. The dean is developing a development office within the school and a strategic plan for fundraising that could sustain this. And I think it's been integral to attracting a class that represents our country, and that is so fundamental to what we want to do. So this is our dean's mission, and we've had tremendous support from Kaiser Permanente. I don't see that going away either. And so the combination of philanthropy and Kaiser Permanente support, I hope, will keep this going. So we're committed to trying to make that happen.
Yeah, that is just amazing, because as I don't know whether the audience realizes, but the education of medical students is wildly expensive. So that is really something. We have a fairly specific question, and I'll throw it out to any one of you. And that is, what is Kpsom doing to address or improve maternal and infant mortality in the Black community?
Go for it, Hunter.
I have a very narrow view of this, and I can give my quick answer, and then hopefully Dr. Carter Edwards can give a little bit broader for the entire curriculum. We, as students, have had sessions already. We had a fetal and maternal medicine, or kind of they're known as high-risk OBs, and we had a OBGYN come and give us a presentation on this very topic, and start a conversation with us that we are continuing to have in doctoring about why these risks and why this mortality rate is higher and what the causes are and how we might address those. So from a student's perspective, we're having those conversations. We are having experts in this field talk to us. And I can tell you that my classmates and myself are, this falls under EID in general, but we're really committed to changing these. And I think that's part of the admissions, was they chose students who really wanted to change these fields. And so we as a whole are asking for more of these kinds of sessions, and telling the school that we really enjoyed those and that we want to hear more, and that we're learning doctoring. It's an ongoing conversation. So Dr. Carter Edwards.
That was great, Hunter. Thank you. I presented the phase 1 curriculum topics for service learning. In phase 2, One of the topics is reproductive justice, and it will cover topics such as maternal health for Black women. And they may also get it in a different fashion. So they do talk about nutrition and other elements, lifestyle factors that may also be related to women's health and familial health. So it is embedded. I think most of the things that you may ask about a particular topic, it's integrative. And that's what makes it difficult to do, but also enlightening, as you evidently heard from Hunter. So we definitely cover the topic.
Wonderful. Thank you. And I think we are beginning to run out of time, but I would like to ask one last question because it's about something that's on all of our minds, I'm sure, and that is how the school plans to prepare the physicians of the future to address the intersection of healthcare and climate change. So if any of you would like to venture into that small topic, please go for it.
Well, very timely, and we're in Southern California where we're obviously so affected by climate that it's impossible to ignore. Hunter, you may not know, but next month in our service learning class, we will be meeting with Physicians for Social Responsibility and doing a half-day session on environmental justice as sort of laying the groundwork in the first year for thinking about, particularly in LA, challenges we have with oil drills, with dry cleaners, and a variety of other areas that Physicians for Social Responsibility have worked on. So we, as Hunter just described, in the first year, we're talking about maternal child mortality in the Black community. We're talking about environmental issues in the first year. And Hunter, you mentioned you're interested in starting a student interest group. So I know that's something you care a lot about.
And I think I'll just add that we're talking a lot about with the school and how they're structuring our curriculum. I think one of the greatest assets of the school, and hopefully everyone can agree with me, is actually the students and what we're interested in and how we push the school. And so I mentioned something I'm interested in is a climate and healthcare interest group, so that we can be the advocates on campus that can advocate for this or that in the curriculum and help find ways and work with the school to change that. And that's one of the great things about such a small school is we can work with the school to change things. So we have a lot of conversations about a lot of these issues, but it goes beyond that we're also supported if we want to pursue exploring these topics. They have the resources for us to actually, and the connections to actually facilitate us changing things and working to change those. So, well, it may not be explicit like health and climate class tomorrow, and that's a month-long class. It's an ongoing conversation about the things that affect our health and how we can change those. And so it's an ongoing conversation because it's not just one thing. It's not maternal health and fetal health in the Black community. It's how does climate also affect that? And so it's a complex topic, and the school is really supporting and working really hard to show how all of these things are actually connected.
Thank you. I would be remiss if I didn't ask this last question, and remiss with regard to my fellow healthcare committee members. And that is, the question is, how does the school integrate and teach integration with other healthcare professionals, meaning nurses, respiratory therapists, other people who deliver healthcare?
I'm happy to also chime in on this. So one thing I did leave out is part of our curriculum is something called interprofessional collaboration. So we actually work with the nursing, Western Health Sciences Nursing School. And so they're nurses who are placed at Kaiser facilities. And we also work with USC's pharmacy school. And we have days where they come to our campus and we do everything from having discussions about the differences in our profession's ethics and code of ethics, all the way through running through scenarios and working with standardized patients and how to really work as a team and what each individual member's role is on a team, rather than just being waiting till we get thrown into the clinic and being like, so wait, what do you do? And so we have those conversations, and we have a class that is specifically designed to help us and the nursing students and the pharmacy students come together. And I'm sure everyone else can speak to this, but in clinics, our preceptors are helping us understand what the PT's role is and how we work with them. So by having early exposure in clinic and this class, we're getting a really broad sense that medicine is a team-based exercise, and that it's not solely a physician's responsibility, it's everyone's, and that we need to know how to work in those teams to provide the best care possible.
Excellent. Okay, well, I really want to personally thank all of our panelists. You guys have just been incredibly interesting and done a very good job in addressing many of the things that we are interested in. And we really do appreciate your taking your time to spend the evening with us. And with that, I think we'll conclude our questions, and I will turn the podium back over to Martha Zavala, who's the president of our League of Women Voters, for her closing remarks.
Yes, thank you. Thank you very much, Morgan. And thank you so much to Doctors Maureen Connolly, Lori Carter-Edwards, and Linda Willis-Jacobo. And of course, Hunter Richards for a superb portrayal of the Kaiser Permanente, Bernard J. Tyson School of Medicine. Go Kaiser. I'm a grateful member. I'm particularly impressed with the effort to ensure that the students are successful and that they feel supported and that they are engaged with the community. You know, your EID is our DEI. We have that in common in the league as an effort that we're making also. You know, I happen to be a Latina. I believe I am the first one in the 85-year history of the Pasadena area. So there is an effort to be made. And I think my predecessor was the first African-American president of our league. So we're working really hard the way I see that you're doing. You know, Hunter, you know, your comment that you can think about my patients instead of my bottom line says it all. You know, thank you very much. And I see how engaged you are. And I think you're very well representing all the work that the school's trying to do. I mean, it's really fantastic. And I really thank you all for coming here. I hope you have a few minutes to hang in there with us. I'm going to make a few announcements before we close. And I'm going to use legal disclaimer speed so I can try to close out at 8 o'clock. So please bear with me. I want to extend an invitation to all of you to join us at our next 2 events. You may not be aware that we have more than just our healthcare committee. We have social justice. We have natural resources, very active in climate action. And so we have a social justice team, a police practices, you know, police oversight committee, all of that. So I hope that you all will find time to partner with us. We would love to collaborate to help extend your reach into our community. The first of 2 events that I'd like to invite you to is Thursday, February 17th, from 7 to 8 p.m. Our Natural Resources Committee will sponsor California's new organic waste requirements, what they mean for you from your kitchen to your yard. That's going to be the first of several that they will be having over the course of the year on different aspects of climate action. And the second event is Thursday with the League, Refugee 101, on March 3rd from 10 a.m. to 12 p.m. Our speaker, Carly Booz, will tell us about the refugee experience as they try to settle in their new country. And you can learn how you can help make this experience a better one for them. And then again, before we end our program, I want to take a moment to acknowledge Black History Month and the contributions of the Black community, including Bernard J. Tyson. Everybody look him up. Dr. Carter-Edwards, you stole my line, so I don't need to repeat any of that work and the wonderful work that he did. And Finally, I want to, well, not finally, but as the League of Women Voters, we honor Black activists and whose sacrifices have resulted in advancing voting rights and civil rights for us all. There's a lot of work that has to be done still, as you can see by the recent bomb threats at historically Black colleges and universities. We can see that, you know, it looks like we can never put our arms down. We have to continue that fight. And as many people as we can get into it as possible. So please make sure you join us. We hope you're going to visit our website, lwvpa.org, to access our monthly publication and get up-to-date information on the continuing struggle to keep our democracy functioning for all Americans. You know, I want to thank also Pasadena Media for the work that you do to help us reach our community. And thank you to Morgan for facilitating tonight's program. Thank you to Dr. Zadowitz, her other half, or the other half of the team. He was working behind the lines to set up all the Q&A session. So thank you to our Zoom hosts, Catherine, Hester, and Veronica. Thank you very much for always putting in the time to ensure we have a successful event. And last but not least, thank you all for joining us. Please don't forget to fight for our freedom to vote. And we hope to see you again at one of our public information events. Enjoy your weekend. Thank you.